The Barlow test is a provocative manoeuvre used to uncover hip instability. The test is performed by standing at the end of the examination couch, facing the baby. One hand stabilizes the pelvis, while the other grasps the knee and flexes the hip to 90 degrees. The examiner's fingers should lie over the greater trochanter or lateral thigh. The hip being examined is then adducted by 10 to 20 degrees. Gentle but firm backward pressure is then applied. A small amount of movement is usually detectable in the neonatal hip, which disappears after a few weeks. If instability is present, a gliding sensation will be felt due to the femoral head riding up onto the edge of the acetabulum. The fingers placed over the greater trochanter will feel the hip lateralizing as this happens. This indicates that the hip is subluxating. If the hip is dislocating, the gliding sensation is present but is followed by a distinct loss of resistance as the femoral head escapes the socket. This dislocation can be confirmed either by relaxing the pressure or by the Ortolani manoeuvre. The Barlow test should be repeated a number of times on each side to ensure that the test is performed in a relaxed infant. The Ortolani test is used to reduce a dislocated hip. Once again, the examiner stands at the end of the examination couch. Both hips are flexed to 90 degrees, with the knee grasped and thigh held between the thumb and index fingers. The fourth and fifth fingers lie over the greater trochanter, and as the hip is gently abducted, these digits attempt to lift the dislocated femoral head into the acetabulum. If the test is positive, the examiner will feel a clunk as the hip reduces. If the leg is then allowed to adduct, the hip dislocates and the leg appears to shorten. Audible clicks